Many people living with chronic pain for years have tried just about everything: physical therapy, acupuncture, injections, other medication, sometimes even multiple surgeries, and still wake up in pain every day. That is the part that can be challenging for even experts to explain. So, our question today is, what if the reason nothing has worked is not what you are doing, but how your body is wired? Ani, when someone has been dealing with this chronic pain for years and nothing seems to provide relief, what may be being missed, in your opinion?
My God, as Dr. Bob knows, there are so many factors can play a role. One of the biggest ones I see is misdiagnosis of the issues. I have seen so many clients, even doctors, come into my office with pain that they were misdiagnosed, but also not looking at the person as a whole system, instead of just saying, oh, your neck hurts or your back hurts, and just addressing the symptoms. So looking at the person as a whole, but also their lifestyle. And for the today's episode is their genetic makeup.
Okay, great. So, as you can see, our discussion today goes far beyond treatment options. It gets into why your body responds the way it does to injury and even recovery. So, joining us today is our favorite pain resolution expert, Ani Papazyan. With nearly 3 days of 3 days. Hey, if you only had 3 days, I wouldn't come to you, Ani. But you've got 3 days.
I would because she's a genius. If she does what she does after 3 days of effort, I'm in.
All
Yeah.
right, but she's got 3 decades of experience helping people who have not found answers to other care providers. She brings a background in kinesiology, medical massage, functional nutrition, and as we talked about, alluded to today, genetic-based testing to understand why some people stay stuck in chronic pain. She started seeing a consistent pattern, and many people were not failing treatment. Their bodies were responding exactly how they were wired. So here's a follow-on question for you, Ani. At what point did you start seeing this pattern? Not for all people, as you've mentioned, but for many people, that this missing piece was not just another treatment, but how their body was wired.
Well, again, when we're addressing the client as a whole, we're looking at, okay, usually a client come to me because they've already been to several practitioners. They've already tried several treatments. So the first thing for me to just kind of get it out of the way is the diagnosis, the correct diagnosis. And then have they looked at their pattern, their lifestyle, is their sleep proper, how they're handling their body's handling stress. If I go through everything and then also, having conversation with the client, then it's like, okay, we need to look at the foundation. How does your body react to your environment based on your genetic blueprint?
But when did this idea pop into your head? Was it year one when you first started being working, or was it
Oh
year?
my God, no, it like
Or,
year probably 20th.
okay,
You're probably 20th. And it was so interesting. I was at this functional nutrition workshop, and one of the guest speakers was geneticist, Dr. Yael Jaffe. And she was analyzing the host's genetic report. And when I heard, I was like, I want to learn that. And not only that, I want to learn my stuff. Like, why have I like always been an athlete, but always had difficulty in losing weight? Why? Why is this like this? All this why, like a 5-year-old or a 2-year-old. So that's what got me interested into, okay, let's get into this.
all right, beautiful. And so that's what we're going to dive in today, how you got into it, what your findings were. But before we do, you always want us to make sure that, this genetic item is not the end all and be all, that is, as you says, part of what you look at, part of the diagnosis. And to help people with that, you've got a little 6 question type thing they can go to, right? Is that correct? What's in that six?
Well, there is usually, people have questions. One of the things people are afraid of, oh my God, I don't want people knowing my genetic blueprint because maybe my employees won't hire me or my insurance company won't cover me because I may have a potential of risks or, first, I don't want to know. What if there is like a high risk or something? Or who's going to be interpreting my report? So that's why I put together a PDF, which will be one of the gifts that your audience will receive is they can see these 6 questions and it puts their mind to rest. And one of the biggest questions is, who's going to share my genetic blueprint, my DNA? Where is it going to go? And there is actually international, well, with HIPAA, it's illegal for anyone, any practitioner to share your genetic blueprint. And that's one of the questions, you ask the company that's running, how do they store your information?
All right, great. So they've got that up on your 6 important questions PDF, which it can be found, but we'll have it in the show notes.
Send you the link, yeah.
Yeah, I've got it already.
I know.
It's called HTTPS, so laststopforpain.com/curious-about-genetic-testing/. But again, we'll have it in the show notes for you. But we just also always here at WellWave Now want to make sure you've got practical steps you can take. And this is part of giving you those practical steps you can take with I. And so you are watching WellWave Now, and this is where timeless wisdom lights your wellness path.
Yeah, you mentioned, Ani, that, some people don't want to know. And there's, that reminded me of that saying, ignorance is bliss, but that shouldn't be the case with your wellness, right? You should be able to take some preventative measures if possible. So, people assume when we're talking about pain that it should be some kind of predictable, path, like an injury or, a treatment or recovery from something. But that, a lot of people actually experience pain that isn't related to a specific injury. And so we want to get into that. And welcome back to the show, Ani. It's always great to have you on the program. You have such a wealth of knowledge, and we look forward to gleaning some of that from you today. So my first question for you today, Ani, is why do some people recover quickly from an injury while others develop maybe a long-term chronic pain?
Well, again, I wish there was like a one simple answer to it, but there is not. The pain starts from a variety of reasons. It could be an injury. And that's one of the questions I ask the client especially when they come to me and they've had pain for a long time. The pain turned into chronic pain is, when did the pain start? What was going on in your life around that time when the pain started? What makes it better? What makes it worse? Have you tried anything that actually worked? If it worked, how long did it work for? So asking all these questions also, how does their body handle stress? Do they take just one, great example, one of the clients I did genetic testing, one of the genes came up that it's an important gene to know if you have it. But I kind of held that back from her, telling her before I slowly worked towards telling her, because I know type of person she is. She would take that one gene that it's not a high penetrance gene and run with it, because she's type of person that it's, what we call hypochondriac in English, you
Hypochondriac.
say? Yeah. She would take that one thing and run with it. So there are so many factors, but genetics is usually about 30 to 40% that affects how your body will turn from just a simple pain to chronic pain.
Okay. So now, as you look at that, so the genetics has that percentage sort of influence on it. When you do that investigation with people, and you talk about that one gene that could really trigger some people. But along those lines of the one gene, are there patterns you're starting to see in people that said these people that are stuck, regardless of the surgeries and even Ani's wonderful visceral medicine, medical massage, they're still stuck in all this, where there's some patterns that are starting to emerge to you that why they weren't getting the progress others were getting.
Oh, absolutely, 100%. And I'm going to take me because I can share my own stuff. Eat healthy, don't exercise the way as an athlete I used to, like a trail running, obstacle course races, crazy heavy weightlifting, but still active. Like I said, eat healthy, do all the right stuff, and still cannot lose weight, have a difficulty losing weight. So you look at meditation, sometimes yoga, great sleeping habits, the hygiene, sleeping hygiene habits, taking my supplements. So when you look at the client that doing all the right stuff and they still not achieving the result, you have to ask what's under it, what is preventing. And that's when I say, okay, we need to do genetic testing. We need to see what's holding you back. Why? And I have an awesome example, if it's okay for me to share.
Well, we won't know until you do, and then
So,
it's okay if
well,
you
you know
know.
how we talk about, like, a lot of times now you hear intermittent fasting, the importance of
Yes.
fasting in overall health. Well, I tried intermittent fasting. I was doing between 13 to sometimes 18-hour fast, about 7, 8 months. I did not lose a pound. One day, I'm talking one of the instructors for the genetics company that I use, and I was just frustrated. So she looks at my report and she goes, well, Ani, look, no wonder you have these hunger genes. If you don't eat every 2, 3 hours, your body holds on to the fat and actually can lose muscle mass instead of fat. And I was like, it made so much sense. But if I didn't have my genetic report, I would be that saying, or people would say like, oh, you're not doing it right, or this just not for me, or,
Right.
whatever.
I practice intermediate fasting every day between 11 p.m. and 7 a.m. That's my intermediate fasting.
Also on the flowers. But now Dr. Bob has been one of those fans of eating every 2 or 3, but he's covered it in the blood, insulin, philosophy, and we actually know it's just that Bob likes to eat.
No, it works amazing for some people, especially for men.
Yeah.
Intermittent fasting works wonderful for men.
Amen.
Thank you, Doctor.
So a question for you along those lines is, so we talk about your genetic testing portion, and I'm actually the same way. Even when I used to lose weight for wrestling, intermittent fasting didn't really work. If I either had to go 2 or 3 ways, I had to go to starving. If I could starve and not eat for 2 or 3 days, and then I would break through that and do it. But just the intermittent stuff didn't do it for me. Aside from genetic test, because you've already answered in one aspect the question of why does certain treatment or approach work for one person but not another, and that could be the genetic component of it. But I also want to ask you, aside from that genetic component, if Breck and I, well, I'll make it Bob and I, but I'll be collegial with Bob this time. So Bob and I both have these knee challenges. If Bob goes in for physical therapy and does ball squeezes in his thighs and it helps him, but I go in there and it doesn't do me any good, what else aside from genetics might be going on there?
Oh, so many things. Is one of the things is stress. How does your body handle stress? Because, in our life, it's impossible not to have stress. We can't say, oh, just deal with it or just don't have any stress, because you come out of your place, your home, it's already stressful.
What are the ways stress causes the result to be different in your mind?
Stress can contribute inflammation. Stress can contribute systemic inflammation. And then with the stress, your recovery can, what's the English word? It can slow down your recovery process. I had a client who.
Now, what word? I'm sorry. What word were you going to give us aside from English? Were you going to go Armenian, or were you going to go Russian
No,
on
I
us?
don't even know in Armenian the word, but I know there is a proper word in English that like how much of the stress, like how short is your
Yeah, the
like the
resilient.
resilience. Thank you, resilience. Yes, that's the word, not the resilience, that your body can handle it before it just breaks down. For some people, it's big. For some, it's small. But also, again, genetics plays a role in it as well. How well your body can handle stress.
I have two questions though, Ani. Could you just give me an example? Because I'm not clear on what would be an example of a misdiagnosis, somebody who got misdiagnosed, and then what did you notice about that? That's question number one, and then I'll just ask question number two after.
So when you said misdiagnosed, when it comes to pain, or is there a connection to genetics or just overall pain?
Overall, what you said that people who come to you in pain, sometimes they've been misdiagnosed. Is that because? So, what would be an example of that?
Oh my God, there was, okay. There's several examples, but I'll bring it in. This gentleman years ago came to my office. He was referred by someone. He was a doctor, and his diagnosis was another doctor diagnosed him with sciatica pain. And him being a doctor, I took his word for it, and I treated him as a sciatica pain. One session, he comes back next session, exact same pain. This point, I'm thinking, Ani, forget his diagnosis, forget what he came with, just do your own observation. After doing my own observation, it had nothing to do with sciatica. It was actually femoral nerve neuralgia. The pain pattern, the dermatome pattern, completely different. At the time, I opened my medical massage book and I showed him, I love this. He said, I'm so glad we figured it out. I looked at him, I'm like, spoken as a true doctor. But that's just one. And last week, I had a client come in. He's been in pain for 5 years. And this honestly breaks my heart when I haven't seen him in over 5 years. And I asked him why it took him 5 years to come and see me, because he's already been to several doctors. He said he wanted to exhaust his insurance possibilities like physical therapist, chiropractor, because I'm a cash practice.
That people waste their time. Like, I have to exhaust my insurance. Okay, go waste your time. Go
Well,
ahead.
that's what he did. And he goes, I wish I came to you 5 years ago. Well, his pain was around the middle of his buttock. So they were treating him as a piriformis issue. But one thing he mentioned to me that was like a light bulb, and I love those moments. He said he went to yoga class and the instructor put yoga block on his lower back. That was the day he felt better for a few hours after that. And I was like, oh. So I did some digging, and it was a lower back issue. The last lumbar 5 vertebrae, which it's called, can't remember the proper name for it, but the last vertebrae moves forward or backward and compresses in the S1 nerve. And that nerve pathway, the pain in where the piriformis is, the middle of the buttock. And I treated him once. He's like, oh my God, I'm feeling so much better. I said, just give me 3 to 4 sessions.
So thanks for covering that. But, to transition a little bit. So, we're not talking about, just the injury or just the treatment, but there might be something even deeper that's going on. And we want to get to what that differences might be. So let's first take a quick break. And when we come back, we're going to get into why is actually behind that, that it may not be the injury, it may not be the treatments. We'll get into that right after this break, a word from our sponsor. And if you are looking for, practical ways to support your health beyond today's conversation, take a look at some of the solutions that we personally as hosts use and recommend. These are tools that are designed to support things like metabolic health, reduce pain, improve your recovery, and help with overall wellness. A Brain IQ Pain Eraser is a roll-on that does just that for pain. Used by our own Tim Daniel after many years of being an avid exerciser and also a D1 athlete. He's put some miles on his knees, and he gets relief with Pain IQ Pain Eraser. It delivers instant targeted relief using advanced nanotechnology combined with powerful natural ingredients that absorb quickly right where you need them. No pills, no mess. Just roll it on and get back to moving. It's ideal for your lower back, your knee pain, your shoulder pain, joint discomfort, and everyday aches and pains. Makes it great option for active adults, busy professionals, or anyone just tired of pain slowing them down. It's compact, easy, and effective. Brain IQ Pain Eraser works when and where you need it. Try it for yourself and experience fast, targeted relief with Brain IQ Pain Eraser. And we'll leave the details in the episode show notes for you. So back to the program here. Before the break, we started to touch on, why people are stuck sometimes. And now let's get into what is actually driving that difference in their biology. And so we want to get into, I guess, genetic testing A lot of people might think or picture that as being something pretty expensive and very, complex. What testing is actually being recommended here, Ani, and how do people get it done, and what does it really cost?
Different companies use different methods. The company I work with, they do cheek swab. There is saliva testing, there is a finger prick testing, and most of these tests done at home. Once you order the test, the kit comes to your house, privacy of your home. You just do it and then put it in a kit, send it to the lab. Usually, as a practitioner, I get the test results, which is a beautiful 31-page report with beautiful pictures, but it's not going to mean much to the person that did the test. That's where, and they're not, the prices can vary from like the 3x4 company genetics that I work with because of so many factors that I prefer the company. You can go on their website and order the test. Is $299 the test. But then you need a practitioner to analyze it. And that's when the prices can differ from $1,000 an analysis to 4, 5, 6, anything in between. It's just depending practitioner. I like to keep mine at the lower level because I want a regular folk that, has been sick and tired of going from doctor to doctor, practitioner to practitioner, be able to afford it. So like for me, I combine it, the test and analysis together. It's $647, which is not, it's very, you get so much information from it.
And that's not something. Well, do they ever have to repeat that test?
No, genetics, because your genetics doesn't change. It's you do it once, but you can take session after session to dig deeper into it because it's so much information.
So now give us some idea of that range of information, because you talked about the one gene that the one client looked at one point, variance there, and then you talked about what are we really looking for? Are there genes that looking for chronic inflammation that lead to chronic inflammation? Are there genes that show for poor recovery? What's the scope of this
That is like Dr. Bob said, I can spend hours talking about it. But usually when the client comes, they have goals. They're the reason that we're doing the genetic testing. So I usually have clients for the first session. Okay, what are your top 3 goals? And that's all I'm going to address with their genetic report. What their top 3 goals is. So let's say if someone is, their immune system, they constantly get sick, or they don't recover fast enough from an injury, or they constantly injure themselves, or even though they eat healthy, their cholesterol is still high, and it's not a genetic thing, but it's just high. So with the genetic report comes everything, the genes, 160 some genes that the 3XO genetics test, it's put into pathways: inflammation, detoxification, oxidative stress, bone and joint, glucose, weight gain, exercise, nutrition. There's several pathways. So the first session is I'm just going to address your top 3 goals. What pathways affect your goal or combination pathways? Because then you're going to have an overload of information. And as humans, we retain tiny amount of information. Everything else is going to go over your head.
Okay. So they give their goals and you talk them and you're talking to them about, what's Bob comes in, he says, my back has been hurting me for 90 years, and et cetera, et cetera. And he says, these are my goals with that. How do you then figure out in this, I've got how much you said, 160 variants or whatever is in there, which one of these things you're going to read for him? Because, I may state my goal is to be able to run up the stairs of the Empire State Building, but my knee only lets me get up half a flight. But then you follow what I'm asking. So how do my limitations manifest themselves that help you understand I'm only going to talk to Tim about these 10 things related to his goal as opposed to these other 5 things?
Yeah. So at that point, I'm looking for the inflammation pathway. How does your body deal with inflammation? Also, recovery and recovery, exercise, and injury pathway. Also, if it's lower back, I'm looking at the bone and joint pathway. Like I said, it's not like I'm not going to pick just one or two pathways to look at it. I'm going to look at how these pathways, like your knee pain, that's not going to allow you to run up the Empire State Building, or your lower back, how these different pathways talking to each other, and what's the best approach for me to suggest you dietary changes, exercise suggestion, lifestyle choices, sleep suggestion, supplement suggestion based on what I see. That's I'm going to put together a complete, okay, this is what you're going to start with. And then I'm also going to suggest, okay, when you go to your doctors, if you haven't had the latest blood work, I want to see your C-reactive protein. Do you have systemic inflammation? I want to see your white blood cells with differentials. I want to see if there is some kind of allergy, histamine that your body does not degrade, because in your genetics, your histamine pathway showed your body, you have genetic variants that doesn't allow your body to break down histamine properly, which can contribute to systemic inflammation. So I may ask, okay, when you see your doctor, could you please ask him to do your histamine test? Can they please do the C-reactive protein or white blood cells with differentials? Because that would give me an idea of, yeah, you have the genes, but again, genetic report is not a diagnosis. It's just a clue. But if you're giving me your blood work, which is a snapshot of what's going on in your system right now, does it give me an idea of, you know what, these genes have been expressed, so let's do something about it? Because just because you have the genes, with your lifestyle, you still have to give opportunity those genes to express themselves. It's like a switch. You turn on or turn off.
Right. Yeah. A lot of people that are diagnosed with, say, celiac disease, right? They have a wheat intolerance. Doesn't come on until something stressful in their life triggers or turns on that switch for them.
Well, I have a great story on it. I had a client years ago. She came to me. She said since she was 6 years old, she had headaches. And she's a trainer. She's an actress, eating healthy, exercising. So we did her genetic testing. She had the HLA gene genetic variant, which you talk about the gluten sensitivity. It's not, complete. So it's a sensitivity for her, the variant she had. She got off gluten 100%. Her headaches are gone. And it's been gone for years, as long as she stays off of gluten. That's just one HLA gene, which is very specific to gluten.
Wow. I love the real world, experiences here. So Ani, when someone sees their genetic results for the first time, what is the most common aha or realization that they have, and to specifically understanding their pain? What do you see with the patients you work with?
There's so many aha moments when it comes to. So for me, one of the aha moments was after doing hardcore, high intensity, like cardio kickboxing that I used to do. I was a Billy Blank's fan. I used to go take his workshops. I was one of his biggest fans of cardio kickboxing. But after every class, 1 hour high intensity class, I would sneeze 15, 20 times without every single time. I would sneeze 15, 20 times. When I did my genetic report, it showed in the exercise pathway that my VO2 max is, I have to work very hard. It's low, which means the oxygen. And that's what made me sneeze so much, because I needed more oxygen. And that's just one of the things. But let's say about pain.
So what did you do with that information?
Well, I didn't come around learning that information until like way after. That was one of my aha, like, no wonder I was sneezing after that, So you just need to, put together your training program differently. It's a slower, you're doing high intensity, but gradually. You're training your body to get more into it. I'm more of a power athlete than long distance athlete. Even though, yes, I've done marathon, but I do more show interval training better than long distance stuff.
Yeah. All right. So Bob, you've heard Ani talk about the testing that she does. But what's your view of do you think more? And I don't know why. And Ani's work really isn't unconventional, so that's why I struggle with this conventional, traditional stuff. But do you think that more kind of conventional, traditional providers ought to be looking at this? And if so, why? How would it shape the way they approach delivery of care?
Well, I think it's really a complicated subject that, like, she knows way more than I do about it, so I would be lost. It would take me a while to that's why I would refer people to her because she can basically manage that. So I don't have that tool in my toolbox, and she does. It's a great tool to have, and it's a complex tool to have because, you've got all the behavioral you get genetics and you got behavior. I call it, and you have behavioral inheritance. People pattern in different ways. So to be able to interpret the interaction between the behaviors in life and the patterns that people develop in life and how the genetics work with that is just so complicated. I don't know, Ani, that was my second question is like, I can see how when you have genetic metabolic pathways where you can identify genes that relate to the internal metabolism and how, because we know that the internal metabolic nature of the body will impact all kinds of chronic pain for sure. But what if you don't have that? Then don't you have to fall back on your other trainings?
You do. Unfortunately, not every client will run a genetic report.
Yeah,
So
true.
because, they never make that connection that, oh, my body hurts. I need the genetic report to figure out the deep root cause of it. They just never make the connection. And if I mention it without building that trust from a client, they're going to think I'm just another person trying to sell them something.
Sure. I have to ask this question. I apologize if it's inappropriate here, but my question is what percentage, when you get genetic testing done, for every 100 tests you do on somebody, what percentage actually gives you great insight into what's going on with that person's experience in terms of chronic pain, let's say?
Percent.
100%.
It gives me clues of why it happens. No, it's fascinating. It's so amazing. Like I can't even, like every time I look at mine, from time to time I go back and look at my own report. I learn something new every single time.
Wow.
That's why right now, nutrigenetics and nutrigenomics it's such a fascinating time right now because there's so many studies, new genes constantly being studied, comes up with the information that we can learn.
So understanding that 100% of those tests coming back and understanding what's driving the pain is one thing, but what people really want to know is what can they actually do with that information? And so this is where it really shifts for some people from understanding the problem to changing the path forward. So my question for you, Ani, is now once someone really understands their genetic profile, what are the first decisions that they change for themselves?
Well, it all depends on a person. As humans, we are programmed in such different ways. So it just depends how me as a practitioner deliver the information and how the person would actually accept it. One of my clients, when I did his report, it came out that he had this genetic variant in his vascular pathway that it's easier for his body to create blood clots. And I know he travels a lot. He flies a lot because his mom is in a different state. So twice a month he flies. And my suggestion to him was, could you please, whenever you fly, wear compression socks because of the possibility. That doesn't mean it's going to happen, but there is a possibility of his body creating blood clots when he's flying so much, especially he's in his early 60s, and how many times we've heard a healthy person all of a sudden drops dead from a heart attack, they were a runner, or they're having aneurysm up in the air. It happens. So just depending on a person, and I try to be very, very careful what I say, how I say. And I always address that genetics is just clues. It's not a diagnosis.
Okay.
It's just a part of information.
Along those lines, and you gave him something to this particular person, and something to start out with immediately, the compression socks. What's sort of the methodology you use and others should use to kind of prioritize? What do they use? Start this first, stop this first type of thing. How do you go about helping them walk through that process?
I always start with nutrition. The nutrition, the dietary habits, dietary suggestions, because that's the easiest thing that someone can change. And that's why, nutrigenomics is such a huge study right now, because how the foods you eat can influence your genes, and also how the genes you have can influence how your body processes food.
Okay, now talk to me, Ani. You're getting a little Californian on me there. My genes. I have some green beans tonight, and that's going to affect my genes. How's that going to happen?
Not green beans, but
Connection.
if you're eating, okay, if I'm looking at your inflammation pathway,
Yes.
and it seems like you constantly complain that, you're eating all these healthy foods, but your blood work still shows systemic inflammation.
Good.
That sounds like Tim.
So then I look at your genetics, and I'm seeing your histamine pathway, that your body cannot break down histamine properly, which can contribute to systemic inflammation. So I say, Tim, how often do you eat healthy foods? Avocado, spinach, strawberries, bananas, eat kimchi, fermented foods, prebiotics, very healthy. Every nutritionist you talk to can give you as a healthy diet all these foods. Well, guess what? All that food I just mentioned is either high in histamine or trigger histamine release in your system. So if you're eating these healthy foods, but genetically your body cannot degrade histamine properly, that stays in your system, and there goes the inflammation.
So I take it's not necessarily trigger. It's not changing my genes. It's what it's doing is you're working with my genes and my genetic makeup to say this is the way that for me I should be eating.
Yeah, because I cannot change your genes. It genes what you have, And what's so interesting, as humans, we share 99.9% of exact same DNA. But that 0.1% that's different, that's what makes us so unique.
So I always deal with stress and food intake, and then patterns, automatic patterns. What are they doing all over and over again? So, and the stress component for me is huge. It's just a big factor. What's your favorite way to help people de-stress? That's my question. Something that's practical for our listeners.
Well, I ask my client, I would ask my client, because a lot of times we say, okay, do meditation, do yoga, do Tai Chi or Qigong, or, breathing techniques. But I ask the client, what's the way that you like to relax? Because for someone, just sitting in the room or walking at the beach, reading a book could be a relaxation, or hanging out with their grandchildren could be the relaxation. I don't know. For me, yoga is boring as hell. Meditation, 5 minutes max. I don't like it. For me, sitting, watching stupid movies, romantic comedy, Hallmark movies, it's amazing relaxation. So I asked the client what will work for them. Then I would give a suggestion. But also looking at the client's genetic, and I love when you said, the dealing with stress is how does their body handle stress? Because for some people, if they have genetics like I have genetics that my body breaks down my neurotransmitters like, serotonin, epinephrine, norepinephrine, very slow. That means they linger in my system for a long time. Well, genetically, I'm more prone to anxiety, stressful life, but I don't have any of that stuff just because of my lifestyle choices. But if someone cannot handle stress, properly. We're looking at, okay, do you have the COMT genes? Do you have the MAOA, part of those genes? How does your body break down those?
Those are those enzymes you mentioned, COMT, et cetera. Those are the enzymes that break down the neurotransmitters. So if you don't have those transmitters will be around a lot longer, right?
So if the depending genetic variant, like for me, I have COMT AA variant, which means everything breaks down in my system slower. My detoxification is very slow. The neurotransmitters break down very slow, which one of the reasons I cannot do cannabis, because I found out the hard way where I went into a full-on paranoia just from inhaling cannabis. Just someone was smoking around me. After 2 hours, I was full on high, into paranoia, having a whole conversation with myself, eating a big bag of Doritos. So yeah. And then the other end is when someone has genes that break down those neurotransmitters really fast. These are the people that can have addictive personalities because they're always going after the next reward. What's my next reward? What am I going to do next? Either they become workaholics, alcoholics, because they're looking for that next reward because their
How do
body.
you
Send them to a therapist. That's not that's outside of my scope of
Your scope.
practice.
Yeah.
But identifying that what the person is. What's so interesting also when we do the genetic testing, you almost can, when we look at the brain pathway, I can almost tell that's why they're this type of person. It's interesting. You can just pick up their personality types also.
So, Ani, now you have this data, right? You've got your genetic tests for the clients that you work with, and do you break it down to practical plan that can be followed day to day, or is it more of a big picture? Tell us how you would apply it for daily.
I put together a complete steps. Like I said, I start with first dietary, from all the nutrients, vegetables, protein, carbs, what to eat, the dietary choices, lifestyle choices, exercise choices, what would work best for them. And then I would go, okay, next time you see your doctor, please ask these questions or ask them to run this tests, because we want to see if any of those genes have expressed themselves, what your snapshot looks like at the moment. So I put together like a 2-3 page of your next steps to do this.
So if someone listening today, they've been suffering with chronic pain for years and they're feeling really stuck, that first step for you is to get the genetic test done?
That would definitely help to get some answers, yes.
And one thing came to me, I was struggling for analogies and trying to make sure we giving people actionable thinking, just as Burke went through. But there's been a lot of talk around my old school, Stanford, talking about genetic based medicine. It is to prescriptions. And what really struck me as I was looking to say how we put this all together for somebody is that what you're really talking about is almost to an extent a genetic based prescription for wellness and for pain relief that you've given people that touches upon what they eat, their exercise, how they sleep, and their environment. So you're really getting a practical, is that correct, Annie? You're really getting a practical.
It's absolutely, oh my God. It's amazing. I mean, you have genetics, and I can mention only one of them, and I made myself a little cheat note, the Psych2D6 gene. If you have certain variants, it's a liver enzyme gene, and it can metabolize medications. As we know, the medications get metabolized in your liver. But if you have certain genes that may slow down the breaking down that medication, which means that medication can stay in your system way longer than for someone who metabolizes faster. And knowing that, I know when I was getting emergency appendectomy, I told the anesthesiologist, I said, my body breaks down things really slow. Please be careful with the anesthesia. And I know after that, for 2-3 days, I was feeling horrible. So, Yes, medications. Again, how does your body process the medications? One of my clients, actually, after I did his genetic report, I didn't know what medications he was taking. But looking at his genes, I asked him, "You're not taking any blood pressure medication, are you?" He goes, "Yes, I am." I was surprised. I'm like, doesn't that make you dizzy? He goes, "Oh my God. You know how many different medications my doctor had to try until we found one that didn't make me dizzy." And I got that all from because of his genetic report.
But again, you're even going beyond, the medication. I think that's part of what they're using the genetic testing for and variants. One to say, hey, this, like you say, this medication works for you, but also to help design medication. But what you're really doing is you're using the genetic testing to design a comprehensive living form. What exercise affects your VO2 more than something else? What diet is right for your genes that you've got there? How might sleep be affecting you? So you really saying that taken and done by a knowledgeable person, this genetics testing can really impact all aspects of their life to improve their pain and their overall wellness.
Yes. And before we finish, I want to make sure, because we haven't touched on this, I want to make sure that people are aware of it. There are genes that call high penetrance genes, and they're low penetrance genes. What high penetrance genes are, like BRCA gene, that women go get tested for breast cancer. That's a high penetrance genes. If you have that gene, I don't care your lifestyle, there is not much you can do about it. Your potential of getting breast cancer is very high. Yes, with the lifestyle choices, you can make sure, but the high penetrance genes, like let's say the family members have 6 fingers. So many different members of that family have 6 fingers.
I think Anne Rice said those were witches.
But those are like high penetrance genes that there is no lifestyle choices can interfere with it. The low penetrance genes, that's what the companies I work with, they test low penetrance genes, because with the lifestyle choices, you can make sure that those genes won't express themselves. Yeah. So people need to know. There are companies like, let's say, Dr. Bob, I'm sure you know the LS download syndrome, which is a connective tissue syndrome that has like a 13 different forms of it, but one of the most common ones is hypermobility. But these people can have so many other health issues. Well, there are companies who test specifically high penetrance genes, like connective tissue genes that specifically has to do with the Ehlers-Danlos syndrome. So people that are looking to do the genetic testing, that's one of the questions in the PDF that I'm giving, is knowing which company to go with. And actually in there, I do state a few different companies to check it out.
Nice. That's going to be great information for everybody. Thank you for providing that, by the way. It's awesome.
Yep. Well, as we wrap up today, I want to thank you, Ani, for being our guest again. It's always great to have you on the program here on the Well Wave Now show. Any final comments, Ani, or questions from Dr. Bob or Tim?
I want to share one of my favorite quotes before I'll give the last word to Dr. Bob, is always keep in mind this quote, genetics loads the gun, but lifestyle pulls the trigger. Just keep that in mind always.
Yeah, I deal a lot with, not a lot, but I deal with clients who have what are considered highly genetic related conditions. And it's really fun when you take a client who has a highly genetically related condition, for instance, like essential tremor, and you can go in there and interrupt that whole pattern. And all of a sudden they're free of that expression. And that always makes me wonder, what's going on with the genetics that our conventional medical system says are, predictive of this symptomology, right? So I always wonder about I'm always wondering about genetics versus environment, and how the automatic patterns interplay with the genetics. It's so fascinating to me, and it is complex, and I'm glad you do what you do, Ani, because it's incredibly complex.
Well, thanks again, Ani, for being our guest today. And, most people dealing with chronic pain are searching for the next treatment. And what we explored today was something quite different. Understanding why your body responds the way it does is, that's the key, right? Is why does it respond this way? So when you understand that, you can stop guessing. So it takes all the guesswork out of it, and you can start making decisions that actually fit you personally. Now, if you found this discussion helpful, subscribe to the Wellness Wave Club YouTube channel and share this episode with someone who is also searching for answers. And as always, remember, wellness, it's in you.